This conference will now be recorded.
All right, folks. So I'm excited to be here tonight, and I thank you all for attending. And I appreciate your time and your sacrifice that you do to come to class, even at the end of your long day of working. And I know that it's a sacrifice, and I appreciate that. So tonight, what we're going to be doing is we're going to be just taking the time to review the skeletal system and the articulating system, the articular system. Really, it's the skeletal system, and we're working with the joints as well as the bones. And that's what we're going to be discussing tonight in preparation for our test on Monday night. So whenever we look at any of the systems of the body, from the remainder of the AMP1 class and into the AMP2 class, for each system that we discover, that we talk about and discuss and learn about, you will have to understand and know the functions of that system. Doesn't it make sense that you need to know the basic functions of each of these body systems that are present that really work as a symphony? So as a symphony, we have all these different musical instruments playing together. Maybe not all at the same time, but they all play together sometimes and in different parts, and they all have their role. Well, that's the same thing as far as the body is concerned and the body systems, and that they all may not be working or functioning at the same time, but they all at certain periods of time in the life of the body and in the life of the day of the body are doing some type of action, some type of function. And when they're all working together, beautiful music like the orchestra, right? Like the symphony. When they're not working together, yeah, disease, right? So lack of proper functioning, then we're having issues with the maintaining homeostasis, a stable environment within inside of the body, no matter what goes on outside of the body. Okay. So you'll see here, and so just you need to review these functions, and it's pretty easy when you think about. So what makes up the skeletal system? It's the bones, it's the ligaments, it's the joints, right? And then the muscles that are attached to. So what's going on as far as the function of it? So that's pretty basic, and you can really review that and know those basic functions. Realize that there's, like I just said, as far as the ligaments are concerned, attaching and can take and connecting the bone to bone, the tendons, connecting the muscle, the skeletal muscle to the bones, the cartilage, which protects the ends of bones. And also remember that the skeletal system begins as primarily there's hyaline cartilage throughout. And so that hyaline cartilage model is really upon which the skeletal system will ossify the cartilage and become bone, right? So, and then what's left over at the ends of the bone would be the hyaline cartilage to protect, it's the articulating cartilage, protecting the ends of the bone, as well as, so like your nose, right? The very large portion of your nose would be hyaline cartilage. And many other areas are hyaline cartilage. We talked about the areas that do not have hyaline cartilage would be elastic and fibrocartilage. And we've already gone over those. As far as fibrocartilage, you have to remember that fibrocartilage would be on between the pubic symphysis and that area there between the pubic bones of the coxal bones. Remember that we also have fibrocartilage in the intervertebral discs, the meniscus of the knee, medial and lateral meniscus, as well as here in the TMJ, we have a fibrocartilage. It's very tough, durable cartilage, fibrocartilage. Elastic cartilage, remember, we think of the E's. We think of the external ear, which are two terms we use for it, the auricle, auricle, and also the pinna. Those are two terms that are used for the external ear elastic cartilage. The eustachian tube, also known as the auditory tube, which equalizes the pressure in the middle ear, that is elastic cartilage. Then we also think of, let's see, eustachian tube, external ear, and the epiglottis. The epiglottis is the area where we're covering over the trachea, and really it's the larynx and then entrance into the trachea and preventing food and liquid from entering in. And that epiglottis acts as the cap, the cover over that system. Okay, so now there you've got. So any place else other than where we talked about elastic and fibro would be hyaline cartilage. So hyaline cartilage is also present in what's called the epiphyseal plate, aka also known as the growth plate. Okay, so this is where growth takes place of long bone. right? So that's also hyaline cartilage. And all other places, hyaline cartilage. So very important cartilage. Remember, cartilage is avascular. So epithelial tissue, avascular. Cartilage, avascular. The cornea of the eye, the lens of the eye, these clear portions of the eye, avascular, no blood vessels. Okay. Now, you'll see here 3-month fetal skeleton completely formed. It's cartilage. It's that cartilage model. It's that hyaline cartilage model. Okay. Longitudinal growth continues up until, really, and later teens. Really, this is, see, bone maturation up until, 21 years old or so. Boys usually maybe will start a little later, go a little later. Girls start a little earlier, and maybe stop growing a little bit earlier than also the boys do, males. The terms that you need to know as far as cells are concerned, it's very important, right? So remember, before I even talk about this, think about cartilage cells. A cartilage cell would be what? Chondro. So we have a chondrocyte would be a cartilage cell. An osteocyte would be a bone cell. So osteo is the word root for bone, chondro, the word root for cartilage. Don't forget that, please, okay? Because when we get into endochondral ossification, what are we talking about there? We're talking about cartilaginous ossification, okay? And that's fetal development, okay? So coming back to this page here, osteoblast, osteocyte, osteoclast. Blasts will build, clasts will break down. Cytes are mature cells. Okay, and then strain on bone increases bone strength. So any type of stress that we place upon bone, if the more stress and strain that's placed upon it, the stronger bone can become as a result of that stress. Okay, and that's Wolff's law. Wolff's law is what really contributes to the fact that if we put stress upon bone, so even if, like, say in martial arts, right, where we're punching up against a hard board, okay, punching up against a hard board, and it's putting stress on the bones of our hand, right, and also the bones of our the radius and ulna, our carpal bones, our humerus, right? We're putting that stress, and as a result of that stress, that can also increase bone density. Lifting weights will lead to an increase in bone density. So even when we have our elderly population, our geriatric population, doing some type of very light weights and just a little bit of resistance bands, that stress upon the bone helps to increase bone density and fight against osteoporosis, right? A demineralization of the bones. So really important for all of our populations, whether they're young or very old, should be doing some form of exercise. Remember, movement is life. That's key. So ossification, this is fetal, right? Fetal. This is, the baby is not born yet, so still in the womb. Intramembranous, endochondral. Think flat bones. So think flat bones. Think flat bones for intramembranous, and you'll see here, dense connective tissue membranes. And endochondral, it's the cartilage. Bone develops from the cartilage itself, okay? So endochondral, bone development through the cartilage. Connective tissue, we're talking intramembranous, and think flat bones. As far as maintaining bones, right? So parathormone, really, it's also, go back and do this. Yeah, here we go. A parathyroid, more commonly known as, okay? So parathormone, more of an older term that's used. Parathyroid hormone, PT, and it's also, you can put PTH, okay? All right, and calcitonin. So we're actually, as a result of PTH, we're increasing blood calcium levels. And I should write that down. increase blood calcium, LEVELS, okay? And so the opposite, decrease blood. Okay. So very important that PTH and calcitonin really work together in helping to regulate blood calcium levels. And how do they do this, folks? So you need to know this also, that so if we're doing calcium release, I'm just adding a little bit of notes here, folks. So you should please notate this and write it in your notes. That also, and it's going to be in the video here now, is that we're increase osteoblastic activity. Increase osteoblastic activity. So then what would, if we're decreasing, we're going to inhibit osteoblastic activity, right? The osteoblasts do what? The osteoblasts are involved in breaking down bone, right? Right, we have bone is in a state of continual renewal, understood? So we're breaking it down, we're building it back up again. We're breaking it down, we're synthesizing new bone to replace the old bone, okay? So you'll see here that these hormones are very important in order to maintain that. And where do we have the calcium? Remember, so look at this here. I've added this slide, and you should please make note and take, I'm going to leave this slide up for a moment here. Write down this information. So bone composition. I didn't know why. I didn't recall that it wasn't in the PowerPoint itself, but I'm giving it to you now to make sure that you're aware of it. I've mentioned it, I've talked about it, but I didn't realize it wasn't in the PowerPoint slides itself. So the inorganic portion of bone would be hydroxyapatite crystals. They're made up of calcium and phosphate. So when we say that, look over here, that calcium storage, right? Calcium release, calcium storage, it's in the skeletal system. So how do we get it? So, and here you'll see that that's the inorganic portion of the bone. The organic portion would be the collagen fibers, okay? Now, this is a great spot. Then I'll wait a moment and let you make sure that you're writing that down. And then what I'll do is I will then show you some images regarding compact bone. I pulled a few different images of compact bone out so that I can show you and share with you, and just to give you an idea of what's going on with the compact bone, because I think there's been some questions regarding that, so I want to give you that. Okay. All right. So I'm going to minimize this here, and I'm going to share some images with you all regarding compact bone. Okay. So let's first look at this image here. So I will share all of these. This one, I think I can share a link to you. I can't share the actual image, but the other three images that I'll be showing you, I can share those actually on documents and resources. I'll put them in there for compact bone, okay? But what you're looking at here is the diaphysis, the shaft of long bone, okay? Now, you'll see here that we have compact bone, we have spongy bone, okay? And then in through in here, the inner portion would be where we would have then the medullary cavity, which would contain the bone marrow, okay? And in the shaft, primarily it's going to be then yellow marrow. At the epiphyses, at the ends of the bone, right? This is where we'll have the actual red marrow, and that's going to be the marrow that's producing blood cells. So the yellow marrow contains adipose tissue, fat, right? Now, you'll see here also that it's kind of hard to see on this image here, but there's periosteum. The periosteum is the outer covering of bone, and there's two layers to that, right? There's that outer layer that's very tough and strong, and that inner cellular layer that's going to be present. So two layers of periosteum, that's the outer covering of bone, compact bone, spongy bone, okay? And so what you'll see here is that, see how we have the osteons. They're hard to see here, but this is just the osteon that we've kind of brought out a bit. And in the next couple images, you're going to see that the collagen fibers go in opposite directions depending upon what layer of the osteon you're looking at. Okay, so that's important for you to be able to see that. I'll show you that. Okay, but here you're seeing the central canal. Here's the central canal. So you're seeing the shaft of the bone. It's this long bone, the diaphysis of the long bone, and you're seeing how we have this hole for blood vessels, for lymph vessels, right, for nerve. This is all going to be perforating through the bone, and in particular, then we have these perforating horizontal type of canals present that are also connecting the different central canals of all these osteons that are present. Now I'm going to minimize this and I'm going to show you then also another couple of images. So let's take a look at one of two more images that I'd like to show you. And again, here you're seeing the perforating canal, you're seeing the central canal. And so here's the osteon. Recall when we looked at it in lab, you saw that it looked like little tree trunks that were cut, right? And that's very easy to spot compact bone. Here you're seeing that we have these different types of layers of bone first, these circumferential lamellae. These are just layers of bone, okay? And then we have these concentric lamellae. These are more of the actual parts of the osteon itself. This is outside, right, deep to the periosteum. You'll have these layers of bone, and then you're going to have these compact osteons here that go down the whole entire shaft of the bone. And then we have, again, the trabecular bone, the spongy bone, and you see how there's the holes present, right? So whether the holes for the central canal contain the blood vessels, or blood vessels will weave in and out of these holes in the spongy bone, okay? Now, we said that there was periosteum, the outside of bone, then the spongy bone is covered in endosteum, if you remember that term, okay? Now, look at this here, and you're seeing that we have the collagen fibers in opposite directions in these layers of bone, these concentric lamellae. See how these have these layers, and the collagen fibers are in different layers, but also different directions that they're going in, and that really is important to give strength to the compact bone. Okay, and you're seeing here this central canal containing vascularity and also nerve and lymph passing through. Okay, let's look at the next image. And just giving you, and it's showing you here a little bit how the blood vessels actually weave in and out of these holes in the spongy bone. And here you're seeing, as far as you have this periosteum that's pulled away from the covering of the bone. Hold on one moment. I just need to have them be a little bit quieter. So you'll see here that the periosteum is the covering of the bone. We have these fibers, these Sharpie's fibers that are actually connecting and anchoring the covering of the bone, the periosteum, the outer covering, to the actual compact bone. Okay, and then again, this spongy bone is covered in endosteum. So periosteum, endosteum covering the spongy bone. And here you're seeing that in these osteons, we have these osteocytes. And so within these osteocytes, there are, again, little canals. These osteocytes are just the cells within the compact bone. And they have little canals here, these little canaliculi, which allow for the cells to connect and reach out to each other and connect to each other. Okay, you see here, here's that osteocyte, that mature bone cell. We have these canaliculi, these little canals that will connect these different osteocytes. Okay? And again, I'll post these images. And lastly, you'll see here, as far as, and here we see that term endosteum, right? So the endosteum would cover the spongy bone, and then the periosteum, you'll see here, covers the outside of the bone. And here you're looking at, you can see those canaliculi, those little canals that will connect the osteocytes to each other. So they have these little projections that reach out to other osteocyte cells. Okay, So again, I'll post all of these images for you all in documents and resources. Okay. And again, you're seeing here as far as the bone composition, inorganic and organic, knowing that the collagen fibers are protein fibers. Let's just remind you of that. They are protein fibers. And you know, I'm going to put next in front of it. They're strong protein fibers, and they really do lead to the strength of bone. And again, going in different directions and such. Okay. We already have talked about and mentioned about regarding compact and spongy bone, and you can see the difference between them. Compact bone contains those osteons, and spongy bone has those rods or trabeculae of bone, because it's also known as trabecular bone. That's another term that you've seen in those images that I just showed you there, and I've mentioned it multiple times. Spongy bone is trabecular bone, aka also known as cancellous bone. And we've talked about these different terms as far as the central canal we've just seen, and it's also aka also known as a Haversian canal. This is an older term. The Volkmann's canal is also an older term for the perforating canal. You'll see here as far as the canaliculi. So the canaliculi are those little canal that connect the osteocytes to each other. Now the osteocytes are residing in these little spaces called lacunae. These little cavities are called lacunae. Down between. Yes, I can do that. Yes, Norma, I'll just repost this PowerPoint, and you can just take from it. Okay, so I'll do that. I'll repost. I'll replace the PowerPoint that's in there for skeletal system and I'll put new one, because then it'll have these little bit of added extras that I've been putting in here. You're welcome. So the trabecular bone, it's a meshwork of bone. Think of like a lattice, Lattice, a lattice of bone, right? We know what a lattice looks like, and so that's kind of the appearance that I'm thinking of, right? And the bone marrow will fill the spaces between the trabeculae. And know that the bone marrow resides that inner space of the long bone would be called the I just mentioned it before. It'll come to me in 1 minute. Now it'll come to me. I'm just, it's okay. I'll think. No, not the diaphysis. The diaphysis is the shaft of the bone. Would be the medullary cavity. Yeah, the medullary cavity. There you go. Okay. So the medullary cavity will contain either yellow or red marrow. Red marrow primarily with children will be more throughout the whole skeletal system, whereas in adults the red marrow will be primarily on the flat bone, the vertebra of the pelvis, the sternum, the ribs, skull, the ends of bone, the epiphyses of bone, red marrow. Okay, I'm going to write that there also. Now epiphyses, let's see, epiphyses. The epiphyses, no, I'm sorry, back here. The epiphyses is, let me just look that up just to make sure I'm giving you the right, let me just look that up real quick. Yeah, the epiphysis and the epiphyses would be, yes, so that's right, okay. That right here. So the epiphysis is singular, and SES is plural, right? That, okay. Let's see, yeah, so the ends of bone, red marrow, hematopoiesis, blood cell formation. Okay, and then we know that the yellow marrow is adipose tissue, is adipose tissue, and it's fat storage. And know that in case of need, that yellow marrow can be converted to red marrow. So know that that's the body's ability to be able to do that, can absolutely do that. And here, so I'll just show you these next two slides, and then I'm going to move on to other PowerPoint and such and notes. So you'll see here that flat bone, irregular bone, short bones, long bones, and know that the bones of the phalanges, they are considered long bone because they're larger in length than they are in width. Okay, so you see here, as we have here, a representation of the humerus, proximal end, distal end, right? And so we're looking at, here's the epiphyses, diaphysis. Okay, epiphysis, diaphysis. And then the epiphyseal plate would be right here and here, the growth plates. Okay, so here we go. Epiphysis, diaphysis, very important to know those terms. And here again, just another, I don't like this image as much, to be honest, so that's why I showed it to you there, but very basically just seeing here how periosteum, the outer covering of bone, endosteum, the inner covering of bone, yellow marrow as far as present within the medullary cavity, medullary canal, medullary cavity is how I've always taught it and known it as, but canal, again, too, it's just a space, right, in between. So very important that you know that, okay? And you can go through, and I'm not going to go through all of these different bones. I would show you this, though. This is important to remember. The axial and appendicular skeletons, right? The skeleton is primarily has two divisions there, and you should know that there are 206 bones in the skeleton, and you should know all the different processes, right? The different terms that we would use that you already took in your first practical regarding the skeletal system. You should know what these terms represent and mean. Okay, so I'm going to minimize that. And actually, I'm going to do this. Let's save this. Oh. Sorry. Okay. I'm going to save this. And I'll answer a question in just one moment if I can see. Okay. Very good. Okay. All right. Yes, I answered those already. Very good. Okay. Let's go to, I'm going to go to this slide. So I'm going to come here to the notes right here regarding articulations, okay? And this would be in chapter 8. So chapter 7 was skeletal system as far as the rhizotext. Chapter 8 would be for the articulations. If you focus on this packet of four pages that I have given you, orbits and the nasal cavities, Evelyn, they are, it's important to know for the practical exam, and you should review that and know that, but primarily it's probably not going to be on the test. I would tell you that if there's going to be plenty on the test, those areas I won't really focus on because I've tested you already in the lab regarding that. Now you'll see here as far as that this no problem. So you'll see here this first page is a very important page and has a lot of information in one page of note. Okay, so this is a very important page to review and go over as far as seeing how the classifications of joints, as far as we have them in a structural classification and a functional classification. Start with the functionals. It's very easy. It's SAD, SAD, synarthrosis, amphiarthrosis, diarthrosis. Or I've also mentioned the terms synarthrodial, amphiarthrodial, diarthrodial, as far as the types of functional classification of the joints present within the body. And they go from SAD, from immovable to freely movable. Okay, so when you think of your shoulder joint, as far as the glenohumeral joint, you think of a diarthrodial joint. When you think of the head of the femoral head articulating with the coxal bone, you're thinking of a diarthrodial joint. Okay, these are freely movable joints. Immovable joints, you're thinking of regarding the suture joints within the skull. Okay, that would be an immovable joint. So we'll look now. That's functionally classified. Now, structurally classified, we're looking at fibrous, cartilaginous, and synovial. And the synovial joint, that's the joint. And we'll look at an image when we see when we get to the PowerPoints and such. You'll see the synovial joint. You're going to have to be able to, from memory, just create a very crude, depending upon how well of an artist you are, a representation of showing me the layers and showing me structures. And there's only a few structures you have to know, but you need to know what's present within this hollow joint, okay? And so that's very important. Now you'll see here as far as the fibrous joints, okay? So suture joints we talked about, that I just mentioned about the bones of the skull and the different sutures that help to intertwine the bones of the flat bones of the skull. The syndesmosis, we're looking at the tibia and the tib-fib distal articulation. So what is it we have? Yeah, I'm going to show you that, Jen. Yeah, when I get to that image, I'll show you that for sure. Thank you for asking. And you'll see the gomphosis, no problem. And you'll see the gomphosis is this would be a peg and a socket. And so unfortunately today I was very well aware of my teeth and having to have dental work done. And oh Lord, not a fun thing. Anyhow, so we get to fibrous joints held together by dense fibrous connective tissue. Cartilaginous joints, we're thinking of a synchondrosis, which would be a bar or plate of hyaline cartilage that unites bones. So the epiphyseal plates, right? This is the growth plates. This is a temporary synchondrosis, because once after maturity, that epiphyseal plate becomes bone. And so it's only an epiphyseal line. So the growth plate, AKA also known as the epiphyseal plate, over time, after we hit puberty and we stop growing, then that will ossify and just become bone. And all that'll be left will be, we say, an epiphyseal line that'll be able to be seen on X-ray and such. First rib in the manubrium, that would be considered a synchondrosis. Very minimal movement, if any, right? A symphysis joint, again, too, the pubic symphysis, we're thinking of where that fibrocartilage is present. The intervertebral joints, where those facet joints, where fibrocartilage uniting bone and such. So this is the intervertebral discs. Sorry, I made it. Intervertebral discs, that's fibrocartilage, okay? Pubic symphysis, fibrocartilage. TMJ, fibrocartilage. Remember, temporomandibular joint, the TMJ, there's a piece of fibrocartilage in there present, allowing for it, because think about this. We're opening up our mouth, opening and closing our mouth many times in one day. So you really need a very tough, durable cartilage to be present to absorb all that abuse. And then lastly, we look at, and we can see here as far as the synovial joints, okay? So these are hollow, lubricated joints. The lubrication is synovial fluid produced by the synovial membrane present within the synovial joint. It's the inner lining of the synovial joint. And these joints, we have the plane joint, the hinge, pivot, condyloid, right? Saddle, and ball and socket joints. You should review these, go over them, look at them and such, and see examples. You can pull up there's in the PowerPoint, you're going to see examples of these synovial joints, and you're going to also, you can go online and do a Google search for synovial joints and see videos and look at images regarding these different types of synovial joints. But these have the most movement that is allowed, right? So they are diarthroses, diarthrodial, very freely movable joints, okay? And you'll see here as far as terms that you should know, as far as bursa and tendon, right? So the bursa, very important as far as allowing for a free movement of joints, reduces friction where ligaments, muscles, skin, tendons, or bones can rub together. So that bursa can also be irritated and inflamed, and we would call that a bursitis. So multiple areas, so the knees, the shoulders, right, anterior shoulders. We can have at the elbow, right, at the olecranon process, there's a bursa present there. And that, if they get swollen, they get inflamed, they get irritated, it's a bursitis, and it could be very painful for the patient. Okay? Tendon sheaths allow for similar to in structure as far as a bursa is concerned, and that they will wrap completely around tendons, and again, allow for freely mobility without friction being built up. Right? Remember, you can take your hands, you put them together, and you do this, what happens as a result of doing this? Friction. You can feel the heat, right? That's not a good thing. Heat can denature protein. What is your body comprised of? Well, proteins throughout. So we don't want friction to occur in areas that can cause damage to the tissues and to the proteins present in those tissues, right? Okay, so these terms you should review, please, these terms and these terms of range of motion. So the ability for my fingers to do this, right? That flexion, that's range of motion. The ability for me to rotate my head, to extend and flex, lateral flexion, right? Those are all terms of ranges of motion, the ability to move my joints in different directions, okay? And so and you should know abduction, adduction. Abduction would be to move away from the midline. And know this, like, so if someone is abducting you, they would be taking you away. So movement away from the midline. Let's see here. I need to just, oh, okay, right here. Okay, I just need to go back to the questions real quick. Are the vertebra, aka gliding joints, amphiarthrosis or diarthrosis? Because some notes said amphiarthrosis. Okay, so it all depends. So really, I would tell you that, Evelyn, the diarthrodial joints are really more the freely movable joints. And so when you talk about like gliding joints, that would be a diarthrodial joint. Okay, it does have it's a synovial joint that does have quite a bit of movement present. Okay, so there is good movement, whereas in amphiarthrosis, very minimal movement. So I would say diarthroses. Okay. And you'll see here as far as common joint injuries. So cartilaginous tears, and remember that it's avascular tissue, so it's going to be very slow to heal, okay? And primarily not a whole lot of healing goes on, and so many times arthroscopic surgery can be a way to remove some of the pieces that have not really joined back together, okay? Because again, it's very slow healing, if at all, as far as cartilage is concerned. Cartilage rarely repairs itself. That's what you need to know. Sprains. So we have a sprain for ligaments, overstretching and tearing of ligaments. That's a sprain. A strain would be overstretching and tearing of tendons, muscle and tendon. Okay. Dislocations and subluxations and bursitis and tendinitis. You should review all these. The arthritides, please review them and see how the different types of how these different diseases can affect the articulations of the body. So please review that, okay? Okay, so let's go to, in this PowerPoint here. So in this PowerPoint, this is from the Scott Fong text. So you see here the Scott Fong text. This is our secondary text, and it's also been posted for you all as far as you have access to this text. I've given you this PowerPoint because I think it's helpful. And really what I want to go to in this PowerPoint is you can scoot through this on your own, but you'll see here as far as the joints are concerned. And so this text will give you the information that I gave you in that note packet. You're just going to be able to look at and see images and just in additional information just to help to reinforce and see these images here are present just to help you as far as understanding and knowing range of motion. And here also this is important as far as the fractures are concerned. Okay, so you'll see here a green stick fracture. So think of children for these green stick fractures because it's an incomplete fracture. And if you remember, we just had a pretty good storm the other day, and branches came down from trees that were only live only a few minutes prior to them being falling out of the tree, and so they're still living like branch and wood. And so what happens when you grab a green stick? You can bend it, right? It has a good amount of flexibility, and then all of a sudden it might break once you get it to a point, but it's not going to be a complete break, so it'd only be incomplete. So this is why we call a green stick fracture. Sadly, green stick fractures also can be as a result of child abuse, and so this is of concern when we see children's spiral fractures. Also, we think of a twisting that can take place of a bone, and so this can be maybe a parent would grab a child and twist their arm, and that's a sad thing. But these are things that we might come in contact with working in a doctor's office, working at the hospital, working in the emergency room. You'll see here as far as an oblique and a transverse, complete fracture and it closed, simple or compound, right? Simple, compound. This would be a fracture where actually bone is perforating through the skin, the integument. Open, closed, these are other terms you should know. Like I said, incomplete and complete, you should know. This here we see as far as there's multiple pieces of bone in the comminuted fracture. How about in the compression fracture? Think of like the vertebra. The vertebral body gets compressed, and that's also quite a nasty type of a fracture that we see quite a bit in practice. All right, so, and right here, this is important also. Now know that really, for as far as in my specialty and such, right, I want to tell you that really a hunchback, really, we're talking of a hyperkyphosis. And when we're talking about a swayback, we're talking about a hyperlordosis. Okay, so realize that we have present within our spine, we have a kyphosis and we have a lordosis. The kyphosis is our primary. So here we go. This is how we're going to do this here. All right, so the kyphosis is our primary curve. The lordosis, our secondary curve. And actually we would say curves, because I'm going to show you, so let's minimize this for a moment, and I'll show you online here. Okay, so lateral view of the spine. So on this image here, let's see how big this is. All right, this is good. Okay, so you're going to see here on this lateral view of the spine, right? And I'll post this image. So let me save this image. Okay, so let's take a look at this for a moment here. So spine images. Okay. Well, I'll get another one. This one, that's just simple enough. Okay, here we go. This is the one that I'll save for you all, and I will post in documents and resources. Okay, very good. So this is the one that we're going to post in documents and resources. Here we go. And I'll increase this a little bit, right there. Okay, so you're looking at the lateral view here, and you can see that we have the kyphosis right here and also right here. Okay, we have the lordosis here and here. So the kyphosis is present within the thoracic spine and also the sacrum. The lordosis would be present in the cervical spine and the lumbar spine. See how the lordosis goes anterior curve? So what you're looking at here is that primarily the thoracic, the kyphosis, as a child starts out, really, their spine is not going to have these lordoses present. As they learn to creep and to crawl, what are they doing? They're on their hands, they're creeping on their shoulders, on their arms, and they're holding their head up, and they're also arching their low back. This is, as they're young, they're very young, helps to promote the lordosis, the secondary curves in the neck and the low back, in the cervical region and the lumbar region. Okay, very important for you to know that these are normal. The lateral spine should have curves. The A to P spine, I'm looking at the, this is the, if I'm looking from P to A, looking from posterior to anterior, and I'm seeing the spine, there should be no curves here. If there's a curve present here, we would say that that's a what? A scoliosis, okay? So no scoliosis here, nice and straight, that's what it should be. That's normal. This, normal. Curves, normal, okay? The spine is stronger as a result. I will post that image, okay? Let's look here and just, I just want to show you, this is the Rizzo text, chapter 8 for the articulations. And see here, you're looking at the different images and you're looking at the different terms that are being used. This is what I wanted to get to. So this, folks, is an example of a basic synovial joint. You need to know the structures of this image right here, okay? So you need to be able to know that when we're looking at bone and bone coming together, this is a joint. At the joint, we have what? We have articulating cartilage, articular cartilage on both ends of the bones. So that prevents the bone from rubbing up on bone. That's hyaline cartilage, is it not? You don't have to tell me that, but you should know that. And just, you need to label it as articular cartilage, okay? Here's the bone, articulating cartilage or articular cartilage protects the ends of the bone. Periosteum is what? The outer covering of the bone, right? Now, we have here this first layer. The first layer, okay? This would be the synovial cavity, the joint cavity, and it's filled with synovial fluid, okay? And so what would this inner layer be? This pink layer would be the synovial membrane, because what produces the synovial fluid? But the synovial membrane. Simple enough. And then what would the outer layer be? The outer layer would be the fibrous capsule. So this is the outer layer of this synovial joint. It's the fibrous capsule. So it's really not too hard, folks. And again, too, you just have to give me the basics. You could even just draw me 1/2 of the image. You don't have to draw the whole, but it's up to you. But I need for you to be able to, and you should just copy this and write this over and over a few times. And you know this information. Yes, this is the one. Correct, Jen. This is the image. This is the example of the image that I want you to know. This is in the chapter 8 PowerPoint from the Rizzo text that I've posted, okay? So this is what you need to know as far as the image for. This will be on the test for sure, and this will be worth a few points, okay? So you need to know this, please. And this, the reason why I have you write this out and do this is because I want you to own this. I want you to remember when you're in practice and you're working with patients who have caused injuries to their shoulders, to the different joints of their bodies, you should have an idea that, oh, okay, yeah, so I remember that there's the articulating cartilage, the articular cartilage on the ends of the bone. There's this joint capsule here that contains the synovial fluid produced by the synovial membrane. We have this fibrous capsule that's on the outer portion, and then the periosteum. You know, just own this, know it, please. Okay? Excellent, good. And then you'll see here, as far as there's just the going over the range of motion and showing you the different images for the ball and socket, for the hinge joint, the pivot joint, condyloid, aka ellipsoidal, saddle joint, right? Think of your thumb, like that saddle joint, and the gliding joints of the vertebra and the facets. Okay. And so that's chapter 8 PowerPoint for the Rizzo text. All right, let's see if I'm missing anything else. So I went over this. I went over the PowerPoints. I went over the images. Okay, let's come back. I'm going to stop sharing. Let's see if I've, in the PowerPoint chapter 7, slide 10. Okay, I have to go back. I'm not sure that, I'll have to go back, Michelle. I have to pull that PowerPoint up again. I'll check that out. Yeah, so Jen, it's going to be probably between 50 and 60 questions. So you're gonna have a little bit more time for your test. I'm not gonna rush anybody out of the testing portion of our class next week, but it's gonna be between 50 and 60 questions, okay? Let me come back to everybody here. Yeah, between 50 and 60 questions, folks, okay? Oh, let me stop recording.